If you are pre-med, pre-nursing, or pre-PA, I have 4 entry-level healthcare jobs that you can start during undergrad or your gap year to gain more experience or direct patient care hours. Hi everyone, I'm Danielle Denise, and for those who may not know me, I am in an entry-level Master's of Science in Nursing program to become a psychiatric and mental health nurse practitioner. Today, I'm making a video for those of you who are pre-med, pre-nursing, or pre-PA looking to get their foot in the door of the healthcare profession. Some of these are jobs that you can start working as early as after high school. And for those schools like PA school that need direct patient care hours, you can get a head start on the hours that you need. Some of these jobs you can even continue working while you're in grad school. It's not recommended, but people find their ways around it. These are all jobs that I'm familiar with. I've either pursued them, done them, or I know friends that are currently in this profession. So I wouldn't recommend anything to you guys that I am unfamiliar with. For each of these jobs, I will give you information on the training and schooling you need to get these jobs, their salaries, and what it is that you do. So let's get into these 4 entry-level healthcare jobs, and I might even throw in an extra 3 just in case you're interested. So be sure to watch this video all the way through, and let's get started. So these first 2 jobs are jobs that don't require extra schooling, meaning they provide on-the-job training. So first up, we have a job that I'm very familiar with. I made a video going into greater detail about it that I'll leave linked above, and that is the job of a registered behavior technician. A registered behavior technician is someone who is a paraprofessional working under the direct supervision of a BCBA providing behavior analytical services to children with autism and other behavioral disorders. For this job, if you're interested in mental health, I really recommend this one. You can find on-the-job training of about 200 hours, and you will take a national licensing exam to become a registered behavior technician. There is room to move up and begin training others, and if you decide that maybe PA school, medical school, or nursing isn't for you, you can become a BCBA, which is a board-certified behavior analyst. Again, I have more information on this career field in a video that I just recently done, so I'll leave that linked above. The median annual salary for a registered behavior technician in the United States is about $35,000. Let me add that I'm including salaries, especially for our students taking a gap year, because we can use some of this money to save to pay for school later. The second job that I have is a medical scribe. Median annual salary for medical scribes in the United States is around $34,000. I even want to throw in that in California, the median salary for a medical scribe is around $38,000. Medical scribes perform secretarial duties for physicians so that they are able to provide more direct patient care. And something that's really great for what's going on right now in the healthcare field is that they are hiring TeleScribes so that you can do your work remotely from home. You will still function as the physician's personal secretary, filling out all of the information and duties that they do with their patients, just online. This job doesn't require any schooling. All you really have to do is just apply, and they provide on-the-job training, and then you start working as a medical scribe. Training is around 120 hours, and in the grand scheme of things, it's just less than a semester of work. So you can definitely get this done over the summers. The next 2 jobs require a little bit more time and payment for schooling to get started in these fields. For both of these fields, you can expect to pay around $1,000 or less, depending on the program and depending on where you live, but don't fret. Also, the programs are pretty short. I've seen my friends get them done in between a fall and spring semester, so over the summer, and the next thing you know, you're out and you're working. And might I add that these jobs may be very beneficial because you're going to begin making connections in the field so that once you're out of school again and looking for a job, you're already going to have your foot in the door. Like I said earlier, technically, you're not supposed to be working in grad school, and somehow people work their way around it. But again, I'll make a video about that, like a separate full video about working while in school. So if in the future I've gotten that video done, you guys should see that linked right here. So let's get into these next 2 jobs. First, we have a certified nursing assistant. And if you're a certified nursing assistant, you're a healthcare professional that will assist RNs and LVNs with patient care, such as dressing, bathing, and other activities like that. You can work in private doctor's offices, urgent cares, hospice, home health. There's many options for CNAs. Training can run from about 4 to 12 weeks, about 130 patient care hours, and 72 hours of lecture work, classwork and coursework. But again, that 4 to 12 weeks can be done over a summer or over like a winter break, depending on where you find your program. Now, since these programs have to be paid for, I want to offer a suggestion. So don't go to a trade school, because you can save tens of thousands of dollars by just going to a community college, or even the Red Cross has a program. Save your money so that it's a good return investment if you're not looking for this to be your end-all career. This last one of my first 4 was one that I was introduced in undergrad because everybody wanted to be a doctor or a PA in my bio and chem program. So everybody decided that they were going to take a summer or a winter to become an EMT. What is an EMT, you might ask? These are your emergency medical technicians. They are the lovely ladies and gentlemen you might see on an ambulance or in your hospital. You'll mostly see them on ambulances providing emergency medical services, but the difference between them and a paramedic is, of course, schooling, and they're not allowed to break the skin with what they do. So they can't do anything or much work with needles, but they can provide oxygen, help with allergic reactions and asthma attacks, and everything else that you see when the ambulance comes in and wee woo, wee woo. Those are your EMTs. Salary for an EMT is around 36 to 37 grand a year, just median across the US, but of course, depending on where you live, that could be more or less. Schooling and training is about 120 to 150 hours of clinical or field experience, and about the same for lecture or coursework. Timing for this is also similar to CNA school, about 4 to 12 weeks or like a summer semester or block. But I find that so many people are going for EMT, programs are kind of impacted, so you need to be on your A game with having all your ducks in a row with the requirements needed so that you can jump in and get in a program ASAP, and make sure you're financially ready. So programs can cost anywhere from over $1,000, like UCLA's program. I think theirs might be almost 2 grand. I can't remember. I should have looked it up. I didn't. I'll try to leave links to programs down below to make up for that, so I'm sorry. But you can go to like a JC or community college and spend like $900 or $800, depending on where you live. As a reminder, I'm in Southern California, and these are prices that I'm familiar with. So yeah, those are my first 4. I know a couple people who are still EMTs, and they're even working while we're in our program. So if you guys have any questions about this profession, I will definitely try to reach out to them and get some insight for you guys. A couple of honorable mentions. I'll just kind of mention the job titles and salaries and kind of what they do. These are for if you have a little bit more time, or if you've taken like, instead of just like a gap year, maybe 2 years, maybe you're interested in this field and you'd be content. It will be the job of a medical assistant, and they make around 35 grand. You could be a lab tech. I've seen them make like starting out at like 40 grand median salary. Some of them are making like 70 grand and they just stay there. Or surgical tech, and they make around 38 grand. Now these are like schooling programs that you might have to go for about like 18 months or longer. More like trade school kind of things. Some lab techs let you out after undergrad, so you just gotta find these jobs, especially if you don't know what you're really like looking for, or which field you're wanting to go into. They're just great places to start and a place to get some experience. Okay, so to wrap everything up, if you found this video helpful or a good place to start, be sure to give me a thumbs up. And if you have any more questions, please feel free to leave them down in the comments and I will answer them there. Or I can make supplemental videos about each of these careers, going more in depth about what you need and what's required of you to start working in these fields. But for now, stay safe, stay healthy, and I will see you all in my next video. Bye!